Thank you very much. I'm going to be presenting on behalf of my co-authors, Dr. Roy Geronimus, Dr. David Goldberg, Dr. Jordan Wang, and Dr. Ann Chappis. This is the result of a multi-center trial evaluating non-focused ultrasound for the treatment of acne scars. Sorry, my mouse. There we go. Sorry about that. Synchronous ultrasound parallel beam technology, which we will call in this presentation non-focused ultrasound for short, heats discrete zones in the dermis while bypassing the epidermis and dermal-epidermal junction. Non-focused ultrasound treats mid-dermal tissue at a precise depth and temperature to stimulate and remodel the dermis. This system uses 7 synchronous high-frequency ultrasound beams that induce dermal heating to 60 to 70 degrees Celsius at a depth of 1.5 millimeters. It creates these unique 3-dimensional cylindrically shaped thermal injury zones with a high percentage dermal coverage per pulse. These volumetric thermal coagulation zones lie parallel, not perpendicular to the skin surface and skin tension lines. Tightening occurs along the direction of facial wrinkles, and the epidermis is fully protected by integrating cooling of the ultrasound transducers. There's no damage to underlying structures, including nerves, bones, blood vessels, or facial fat. This study was undertaken based on the ability of this system to improve wrinkles, increase the volume of the dermis, and tighten or lift skin. And so the idea would be, could we remodel the dermis to improve acne scars as well? So how does non-focused ultrasound works? There's controlled fractional thermal injury to the dermis. At least 25 to 30% of the tissue is covered in one treatment. It's centered around a depth of 1 to 2 millimeter at 1.5 millimeter being the center point. There's no injury to the epidermis of the dermal-epidermal junction, and the optimal thermal dose has been determined to be 60 to 70 degrees Celsius for a period of 4 to 5 seconds of exposure, and has been shown to induce collagen, elastin, and hyaluronic acid remodeling. There was modeling of thermal profiles and zones of effect versus energy that were used to determine the ideal energy to achieve the best effect in terms of remodeling the dermis with this technology. Pig histologies, there we go, oops. Pig histologies were also performed to determine the ideal energies and treatment parameters, and the pig skin biopsies were compared to the 3-dimensional modeling of the of skin thermodynamics of collagen denaturation, as shown here, to determine the ideal parameters. Dr. Virginia Benitez-Roig performed a series of histology studies looking at H&E as well as various immunohistochemistry, and demonstrated the increased deposition of collagen, elastin, and hyaluronic acid following these treatments, as well as increased dermal proliferation using staining for Ki61. This pivotal multi-center clinical study for acne scar treatments, we had 67 subjects from 4 U.S. sites. There were 3 monthly treatments followed by a 3-month post-laser treatment follow-up. 3 independent masked reviewers who were not involved in this study were asked to identify the randomized post-treatment images, and the acne scar severity was ranked using a 4-point scale. Anticipated tissue responses and adverse effects were recorded throughout the study. Subjects ranked their discomfort during treatments. 3 blinded reviewers correctly identified the pre- and post-treatment images for 97% of the patients. This was statistically significant. The mean improvement level of 1.05 units using the severity scale for acne scars represented an improvement of 46% from baseline. There was high patient satisfaction. Most of the patients reported none to moderate levels of pain during treatment, but no discomfort afterwards. There were no device-related adverse events. Patients just had some mild erythema and edema after treatment. I'll show you a series of before and afters from the various sites. Type 4 scan shown here. Here, photo type 3 scan, type 4 scan, type 4 scan. These are all at 3-month follow-up, type 3 scan. Another view of the same patient. Another patient here, type 3 scan, and type 4 scan. So treatment with synchronous high-intensity non-focused ultrasound parallel beam technology safely improved the appearance of acne scars. There was no downtime following treatment and no adverse events. Thank you very much.